This video is for people that have that flat back syndrome, back pain with difficulty breathing. Now, when people have a flat back, it's typically going to be due to an extension malposition of the vertebrae and the rib cage. The rib cage is actually coming up in this direction. It's stuck in this direction. What it does is it causes dysfunction to the diaphragm. When you have dysfunction of the diaphragm, you can get this abnormal breathing pattern. With the abnormal breathing, you're going to get anxiety and possibly panic attacks. So these exercises are going to be designed to release this thoracic spine and release the diaphragm, normalize the breathing, take care of the back pain in that area that typically comes up from the extension malposition. All right, the first exercise that you're going to do is mobilization of the thoracic cage. You're going to go from the thoracic cage all the way down to the lumbars, but the mid-back, remember, it's stuck in position. The whole rib cage is this way, which means all the extensor muscles are just kind of tight and locked in there, locking the vertebrae into an extension. So you want to mobilize it with either a lacrosse ball or a baseball. We're going to use this softball right here. And we're going to start up between the shoulder blades. So it's very important when we're doing this mobilization that you breathe. So the breathing portion is that you want to make sure when you're breathing is not to breathe a big breath and go in extension. You want to take a deep belly breath, not a chest breath, a belly breath, so it stretches out the diaphragm while you're in this position, either in a neutral position or slightly flexed. And it'll help stretch out the diaphragm and stretch the areas that we want to stretch. So we're going to release this first. You just take the ball, put it between your shoulder blades. You want to find an area where it's a little tender, roll up and down, go to both sides. It should take you about 2 to 4 minutes to go through this mobilization. You can spend longer if you like. And as you're doing, if you find a hot spot in there that's a little tight and tender, like little nodule, then you want to take a deep breath and you move your chest around. You go a little extension, then to flexion's good. Get that range of motion to release it. You lift your arm up, that's okay. Once you find one spot, go to the other side, look for another spot, take care of that one, then you can work your way down, because most people are going to have that pain right in between where the rib cage meets the low back. So you want to come in here, you're going to be targeting the rector spinae, the multifidi, the lats, the obliques, the QLs. So you come in between the rib cage and the pelvis, come all the way out a little bit between those areas. You can target some of the obliques, maybe real tender in this area. Take a deep breath. Stretch, come a little forward and twist. Feel that pressure all through here as it stretches and releases some of these areas. You can go to the other side. And you're going to definitely find one side is probably tighter than the other, and definitely those sensitive areas. But just go into it, move into it, relax, breathe. Get the lats stretching. Another spot. So it'll take you about 2 to 4 minutes to go through these and to release those muscles. First exercise that we want to do is that we want to just get motion back in the spine. So you want to get on your knees. You want to keep the breathing going. You want to just go ahead and reach up over your head. We're going to go side to side, going straight lateral, but don't go in extension. Breathe deep and keep the abdominal muscles slightly contracted. Go to the side so you can feel it stretch all through this side area, all the way up under the armpit. 1 or 2 breaths. Go to the other side. And you can go ahead and start flexing forward and across. Breathe. Bring your chin to your chest, though. When you bring your chin to your chest, you're going to really feel it stretch through your mid-back. You're going to feel it through the lat, all the way down the obliques, the QLs, rector spinae. Reach. Come back up. Keep the abdominals contracted. Reach to the side, go forward. Breathe in that stomach, let the diaphragm stretch. Chin to your chest. Finish the stretch. Now you want to do some cat camels, cat cows. You want to brace abdominals and just get motion back in the spine. Remember the breathing. Breathe into that stomach. You know, accentuate the angry cat part here. Really feel chin to your chest. You want to do about 5 to 10 of these. They'll start providing motion back into that thoracic spine all the way to the low back and freeing up those areas that you already mobilized. Next thing what we want to do is we actually want to do strengthen the abdominals. You want to brace it and flex the rib cage forward during this process. You want to do abdominal curl-ups. You want to keep the breathing going in here. Then you want to brace, breath. You want to reach out, grip with your hands to get the whole area activated. Bring your chin up. You can actually bring your chin to your chest on this one. Feel it contract for a good 10 count. Breathe in into the stomach. Should be able to do 1 or 2 of these breaths while this is contracted. Come back down, relax. Come back up, flex forward, breathe. Reach. Really feel that's going to get the whole abdominal, the rectus abdominis, obliques. Activate those areas and relax. You want to repeat that about 5 to 10 repetitions. Next exercise is the lateral plank. You're going to get the obliques and the QL involved. You're going to come up to this position here. Brace. Take the breaths. Breathe easy, but keep it braced. Really focus on the bracing. Don't arch back. Make sure you're neutralizing and keeping the neutral posture. Reach up. Do a full 10 count. Then you can switch after a 10 count. Do the same thing. Breathe. And after you do a 10 count, come back. Repeat. Breathe. Now you want to do about 5 to 10 repetitions each side of the lateral plank. Now all these exercises you can do anywhere from 1 to 4 times per day. If you have a lot of breathing difficulty and you feel really locked up and you're always sitting down at a desk and you're arching your back too much, you find yourself stuck in that position, maybe you just want to do it 4 times a day until it breaks, and then just do once a day after that.